Welcome to Master Lu's Health Center's podcast, where we discuss all things Chinese medicine and Chinese martial arts. Our goal is to help you achieve better health and wellness. We hope you enjoy today's episode. Hello, everyone. My name is Master Tyehao Lu. I'm from Master Lu's Health Center, and this is Kevin Weisenberger with me.
I'm the office manager at Master Lu's and one of the Tai Chi instructors.
Yep, and we'd like to welcome you to this podcast episode with Master Lu's Health Center. Today, we have an interesting topic. So I'm a licensed acupuncturist and a Chinese medicine practitioner. And as part of that, when I'm treating patients and talking with people, one of the main topics that we always have with acupuncture is, what is it? You know, I'm always asking patients, oh, do you know much about the acupuncture? And so we just like to discuss that today about acupuncture and Chinese medicine and what it is and experiences with it. So what's your take on it, Kevin? What's your experience with acupuncture and Chinese medicine?
So I first got my first experience with Chinese medicine was probably a few years before I started working at Master Lu's. I started learning about Qigong, and it led me to starting to understand what Chinese medicine is. And to me, it is a system of helping to improve life by removing blockages and to help improve the body's overall function and to bring it to a natural balance as it should be.
Yeah, definitely. That's what it is. So when in the old times, so the acupuncture, when they were trying to discover it in ancient China, they would first use, we call it 扁石, which is like a small flat stone. In the old times, there were people that they would touch, like palpate their arms or palpate their legs, and they would feel different things. And they noticed, when I'm palpating and I use the stone, there was like an effect. And so over time with that, they were able to map out the points and the channels in Chinese medicine. And so the channels, we look at in Chinese medicine, we look at channels, or a lot of people call them meridians. And so the channels is what transports the qi and the blood throughout the body and to nourish the body's organ systems. And with those, along the channels are the acupuncture points. And so over time, in the ancient time, they were able to map out, and through clinical practice, through observation, they were able to develop the whole system of Chinese medicine.
Yeah. One thing I find interesting is the concept of channels, because I think it was like the 15th or 16th century, the Frenchman, he wasn't even a doctor or anything. He first went to India, learned about Ayurvedic medicine, and then he went to China and he translated the word that we use for channel. He translated it into meridians, I think is how it went. And he changed a lot of things of the understanding of Chinese medicine, like qi. He changed the meaning of that to something that was different.
Yeah.
You want to expound more on that?
Yeah. So the channels in Chinese medicine, in Chinese, we say 经脉 or 经络. In the Huangdi Nei Jing, which is the Yellow Emperor's classic of internal medicine, that's what it talks about, and those are the words. So when you translate 脉 in Chinese, from Chinese to English, it's actually like a vessel. And so the channels themselves, they are actually spaces within the body that encompasses like the connective tissue, the nerves, the muscles, but they're actual spaces that you can actually palpate along the body, and you can actually do diagnosing with the channels. So like if there's different changes like nodules or tension or different feeling along the channels, you can diagnose and say, there's a problem. There's like problem along this channel. When I'm treating patients, especially pain, they'll say, oh, my pain is, for example, on the shoulder, and maybe it's in the front of the shoulder, and you can palpate and you can see what channel is affected there. And that's where it helps us to, as Chinese medicine practitioners, to formulate what's going on, especially along pain problems. You can use the acupuncture. And so, yeah, the channels they're the basis, with Chinese medicine theory, a basis, the channel theory, because the channels will also connect to the organ systems. So even though they go along the body, you have, like a lung channel, a spleen channel, like that. And the channels will go from the extremity up through and will actually connect to the actual organ, whether it's the heart, the large intestine, like that, and then go down or up, depending on what channel, if it's a hand or a foot channel. But the interesting thing is that over time, if there's imbalances within the channel, then it will affect even like the actual organ itself, because it is connected.
Yeah.
So the channel theory is it's an old theory of how, and the basis of one of the bases of Chinese medicine. With with one of the things when we say, here we talk about acupuncture, but it's a lot more than that, because Chinese medicine comprises of the acupuncture, the Chinese herbs, the Tui Na, Chinese medical massage, the nutrition, like Chinese medical food therapy, and even exercise like Tai Chi, Qi Gong, like that. And so as a Chinese medicine practitioner, not only that we practice the acupuncture, which a lot of people like and come in, it's one of the major modalities, but it's also everything else with the nutrition, the herbs, the diagnosing, everything. So it's a complete healthcare medical system that will help your body to self-heal.
Yeah, that's interesting. Now, I think I remember there's something like 361 different points on the body.
Yeah.
If you're treating someone for something, you'll use multiple channels to treat something. Is that correct?
So it kind of depends. So there will be overlap in channels and stuff, depending on our diagnosing. Sometimes, for example, if there's pain along the arm, some people will have maybe on this side pain and on the inside pain. And so those are two different channel systems. And so, yeah, we would choose points that maybe are along that same channel or and that will affect both channels, like that, or points along that channel. So we would treat two channels at once, depending on what's going on, depending on the diagnosing, and as we palpate, as we feel the pulses and stuff. And so, yeah.
Yeah, I know one thing I find interesting is before Chairman Mao, there was Chinese medicine was a little bit different, but it's still effective. What kind of changes happened that you think improved Chinese medicine or disproved?
Before 1949, Chinese medicine was different. During the time of like the Cultural Revolution and after 1949, there were Chinese doctors that tried to keep the full essence of Chinese medicine and the diagnostics, the theories and everything, and the way of practicing. But as in the 50s and the 60s, education started to change and people were starting to take out things, and they were trying to fit Chinese medicine into a Western medical model. And so that's where you get, in a lot of the textbooks, you'll get like the protocols and stuff saying, okay, this person has low back pain. This is what the only protocols there are, especially for acupuncture and herbs. And they were trying to also fit acupuncture itself in a herbal protocol, in a herbal model, and in diagnosing. And so most of that just it got almost simplified a little bit.
Yeah.
And though there's the essence of Chinese medicine, a lot of it did get simplified, but there is more and more practitioners that are going back to the classical type Chinese medicine according to the Chinese medicine classics. And so
that seems like a good thing to do.
Yeah, it is. But then there's also still progression, because you're still learning, you're still practicing, but you're using the theories of according to classical Chinese medicine, instead of thinking, there's the low back pain, these are the set points. There won't be any protocol because everyone's a little bit different. And so when you see a patient come in, you'll do your Chinese medicine diagnosis according to their constitution, to their body, what's going to happen. And as you treat them, then you may use different points. You may use a different channel than what the effective channel is to balance that channel, or especially with acupuncture, or you may use a different way of how to use a formula instead of the textbooks, a lot of the way, like having protocols and stuff. And so it kind of goes away from, like, classical Chinese medicine will go away from protocols, and it kind of depends on what is happening with the patient. That's why you have to feel the pulses, look at the tongue, palpate the channels to get a clear sense of what's happening with the patient itself. So that's like what has happened, a lot with the changes. So with the acupuncture itself, the acupuncture, I tell people that it will help improve the blood flow and the blood circulation. And that blood flow is what will stimulate and promote your body's self-healing mechanisms. And so when we find the Chinese medicine diagnosis, then we use, and what channel is affected, then we'll use the acupuncture, use the Chinese herbs to help promote your body's self-healing mechanisms, to balance your body.
Okay.
And so the blood is what will help heal the body as it moves. So the qi in the blood, the qi is what it goes along with the blood. And so qi, a lot of times people, and what you're mentioning about the French guy, he said, the qi is the energy, the vital energy. And that's what most people will think about. But it's not a full, qi is not, it's not, as energy is not a full translation of it, because the concept of it is a lot broader, a lot deeper. It's like a potential for energy. And so it's not equivalent to say qi equals energy.
Yeah.
but it's like the potential. But the qi is also like it's like a building block within the body, and it will be an essential substance within the body that will help give function to your organs and to your body. And that's what qi is. And qi gives function to everything, you know. So even in the environment around, that's what will give the function, the life to everybody.
Yeah. I know we've had many discussions about things that modern science is starting to discover about the human body and about Chinese medicine that we see in the classics. And what would you say is some of the biggest ones that you've seen personally that modern science is finally catching up to Chinese medicine?
So modern science, you know, have found that there's been a lot of research, a lot of biomedical research done specifically on acupuncture here in the U.S., on how the mechanisms work. One of the theories and what they've found is that it acts on the brain and releases neurotransmitters. So things like endorphins, natural hormones within the body, like serotonin, melatonin, dopamine, things like that. They found that it will act on the central nervous system to release those chemicals that will stimulate and promote your body's self-healing mechanisms. That's one of the reasons why acupuncture itself is used for a lot of pain problems, because it releases endorphins, which is like your body's natural morphine, and will help with that. Acupuncture has also been found to change the blood chemistry within the body. And like what I was saying, it improves the blood flow. And that is what will also help heal. In the old Chinese classics, which is interesting, it says, you know, that whenever there's no free flow, there's pain. And so free flow of blood, they already knew that. And so they knew that the acupuncture will improve that blood flow and that blood circulation. There's also theories where, so there's a gate control theory, and along your spine and the central nervous system, there's different pain receptors, different receptors. And so they found that acupuncture will close those gates, and that's what will help control, like especially pain problems. So open and closing those gates to block the receptors and stuff. They found that as a theory. There's continues to be more, just more research on it. One good website is called evidence-based-acupuncture.org, and that shows goes even deeper on the medical mechanisms, the biomedical mechanisms of how acupuncture works. And it's been shown to work, and that's why it continues to grow. That's why it's still here and stuff as a medical modality.
Yeah, it's really amazing thing. I remember before I started, I was with another Qigong master, and he loved telling a story where there was in China, there's these guys that took wooden like needles and put them in trees, and the trees that had the acupuncture done, their fruit was better and juicier than but even better tasting than the trees that didn't receive it. I found
that's interesting.
Yeah, I found that to be an interesting one. We've talked about him before, but now we focus a lot on pain management because that's the big thing that's going on.
Yeah.
What are some other things that Chinese medicine can help with?
There's a multitude of things. So we help with not only pain, so chronic pain, any type of pain, low back pain, migraine headaches, things like that, but also digestive issues, stomach problems. I treat a lot of people with like constipation, IBS. There's people with nausea and vomiting that we help with. Any type of digestive problems. We help with autoimmune problems. I help people with lupus, SLE, also with rheumatoid arthritis, a lot of different autoimmune diseases that people don't even know that they have or been diagnosed with the autoimmune. And so it helps with that. We've treated people with stroke rehab, help try to rehab from stroke problems. I treat people with high blood pressure, with diabetes, controlling, and also a lot of the major one is like stress, anxiety, depression, a lot of people with that, and alcohol and drug addiction. You've seen people that come in for all of that. So
yeah, one of my favorite stories is we had a patient. He was like 92 years old, somewhere around there. Came in with his daughter one time, and he was doing what your dad called old man shuffle.
yeah,
Just tiny baby step type things. Had a cane in one hand, and his daughter was had his arm on the other side. And I think it was like after 5 treatments or so, he came in without his daughter, and then additional. I think total he had like 20 treatments. But after 20 treatments, he was coming in by himself, no cane, and he joined me for the beginning Tai Chi class that I had at noon.
That's amazing.
That's one of my favorite stories because it just shows how powerful acupuncture actually is.
Yeah, I mean, the acupuncture and all the Chinese medicine can transform lives.
Yeah.
With that type of health transformation, improve the quality of life. And some of the things that people don't realize is that a lot of times is that we do a complete diagnosing. And so a part of the Chinese medicine diagnosing is feeling the pulse and looking at the tongue, asking questions. The pulses are very unique in Chinese medicine. There's, in the textbooks, they'll say there's 28 different types of pulses. And so when we're feeling the pulses, we feel the nature of the organs and what's going on with the organ systems. And so you'll feel like maybe the heart and the lung, the spleen, like that, the liver, and you can feel how fast the pulse is, how slow it's going, the width of the pulse, the way it's beating. And that gives you ideas and thoughts on what's going on in someone's body, It's a diagnostic tool so that we can form what we call patterns of disharmony, and to be able to make that Chinese medicine diagnosis. Those patterns are unique for everybody. So for example, if someone came in to me and they have maybe a migraine headache, and they have it, say, on the right side, their stress is high, and their bowel movements aren't as good, and we're asking questions. Their energy is low, and then they maybe they have like a reddish tongue, maybe some yellowish coating. I feel their pulses, a little bit bounding, it's kind of rapid. So that type of a headache, even though they have a migraine here, could be like a liver gallbladder disharmony. We say in the Jue-yin channel, could be out disharmony with internal heat. They have some heat signs going on. And then we can also palpate the channels to confirm, is that a liver gallbladder problem happening? Especially if it's on the side of the head, it's more like a Shaoyang channel.
Yeah.
So the gallbladder channel happening there. But then if someone came in and they also have a migraine headache, similar kind of presentation where the headache's at, but their energy is low, they have dizziness, they have palpitations, I feel their pulses is weak, not as strong, maybe some deep pulses, and maybe they have some blurry vision like that, maybe some dizziness, things like that. Their bowel movements could be loose. So that is a deficiency.
Oh.
So that's a different way. So we would choose different points, different herbs for that person, even though they present with the same migraine headache. And so we would, they come in, we would do different type of a treatment for them.
I find that interesting that people can come in for the same problem and yet it be a totally different diagnosis. And the approach to each one
could be different.
Yeah, totally different.
Sometimes some of the main, like if I was to use acupuncture, some of the local points could be a little bit the same, but distal points, whether it's excess or deficiency, if they're having, a lot of heat signs in their body, or if they're having a lot of, if they're just tired and stuff, could be different points according to their constitution, or what's going on with their body at that time.
Yeah. So. I think one question that people ask, are there side effects to acupuncture? And you and I talked about it, and we actually, on our form, we have a list of possible things that may happen. They're extremely rare. Would you like to?
Yeah. So some of the side effects would be, sometimes people after acupuncture will kind of get maybe a little bit dizzy sometimes, depending on how their body is, if they've eaten and stuff. That could be it. There could be, within your body, on your body, you have a lot of different veins and vessels and capillaries and stuff. Sometimes there could be like a little bruise or something, especially on the extremities, sometimes on the face or something. If it's around the eye, there could be maybe a little bruise. But those are kind of,
extremely rare.
Yeah, rare type things. It just happens every once in a while. Some of the other side effects, these are extremely, extremely rare. Not even, is like I've never even seen it. But some people will needle wrong, maybe puncture an organ or something like that.
Yeah,
that could happen, but it's very, very rare with the acupuncture. If you haven't eaten as much or something, some people will maybe even pass out or something, but that's also a rare side effect. The side effects with acupuncture is so minimal that you don't ever see it. And that's why acupuncture is is very useful, especially with cancer patients, to support cancer treatments, because it helps with the side effects of chemotherapy, but there won't be any side effects interactions with like chemotherapy or with radiation and stuff, because there's no drugs or herbs or anything like that. Herbs, you have to be a little bit careful with, drug herb interactions. You have to be careful with that in terms of if people are taking a lot of medications, or like blood thinners, things like that, that you have to be careful with, or even chemotherapy. You have to kind of time it right and do things right with that. But and so that's where you have to be knowledgeable about the herbs and the way that you have drug herb interaction and stuff. But with acupuncture, there's like very, very minimal side effects. Yeah.
I remember one question, a guy came out and he was feeling really good after his first treatment. And he's like, okay, what drugs was on that? And I'm like, there is none. It's just the needle being placed in the right spot.
Yeah.
And he was just floored at the fact that there's no drugs on him.
Yeah.
Because we're so used to everything being drug related now.
Yeah.
And so it surprises people when they find out that there is no drugs added to it.
Yeah. And that's one of the things with, one of the questions I always get asked, is there anything on the needle? And we say, no, there's nothing on the needle. The needle will help stimulate, again, that blood flow, that blood circulation to allow your body to self-heal. And that's what the needle will do, to move the energy and the blood and stuff. And so, yeah, it's very effective. There's a lot of the organizations, I actually have the list here, with national and international health organizations that have shown different problems that acupuncture has been useful for. And a lot of these are like adverse reactions to radiotherapy and or chemotherapy, abdominal pain, allergies, so allergic rhinitis, so like hay fever. I treat people with Bell's palsy. They have Bell's palsy, cancer pain, Raynaud's syndrome, prostatitis, polycystic ovarian syndrome, peptic ulcers. So there's a lot of things, osteoarthritis, obesity, a lot of different things. And there's the leading, so like the NIH, the World Health Organization, those leading organizations have dove into to see what, if acupuncture is effective for those type of things. Some of the current research that's been happening is, and you can find it even on like the National Institute's website or other organizations' websites, research on acupuncture and insomnia and acupuncture and fibromyalgia. That's a really big one with fibromyalgia. Acupuncture and depression is a very good one. Acupuncture and hypertension. And so those type of things, it just continues to be more and more research on the acupuncture and specifically acupuncture, because people like it here. There's in China, and there's more research even on the Chinese herbs and how Chinese herbs will work on different health elements. You can treat all these things. And it's not just, treating pain. It's everything, internal medicine and all of those type of health elements that are related. But one of the things too is I get, how many treatments should I have?
Oh, I hear that one a lot too.
Yeah, we have it all the time. How many treatments should I get? And the treatments, it all kind of depends, but acupuncture will build upon itself. And so it's comprehensive. And so every time you come in, you should get better and better. That's how it'll work until your body's balanced, until we see even more results and stuff. So you should get better and better. And so I usually recommend, as a first set of treatments, like between 5 and 10 treatments of acupuncture. And then at the same time, we give herbal medicines as well. And then we'll reassess. And that's usually within the first 5 treatments, you'll see a difference. And then we keep on going closer together. If you do, it's harder when you do 1 time a week treatment and then try to say, okay, let's get better, especially in an acute phase, because during the relief care, you need more treatments closer together and like 2-3 times per week. So it builds upon, your body gets more balanced. And then afterwards, you can start spreading out the treatments. So we have like that acute time, that's 5 to 10 treatments. And then after that, we'll reassess. And depending on problem, if you're not having any problem, then you can just come as needed. Or if you still have, then we start spreading treatments apart. And then at the end, you can do maintenance or even preventative care. Yeah. I have patients that come in as preventative, once a quarter or something. And so just to help prevent, from having illness, because the acupuncture will do that. Help your body build its immune system and prevent from getting sick.
Yeah. If you could give advice to the people watching this video or listen to the podcast about their first time coming in for acupuncture, what would the advice be?
First time when they come in is make sure you eat a little bit before you come in. And then you can wear, sometimes we provide gowns, but it's also if they want to wear some looser clothing, they could wear some looser clothing. And our treatments are usually, 45 minutes is what that they're there for. 45 minutes to a little over an hour. But we leave the needles in between 30 minutes and 40 minutes. It takes 30 minutes for your qi to flow through your body. In the old medical classics, that's what it said, 28.1 minute. But it takes 30 minutes for the circulation. And so you leave the needle in for 30 minutes to help stimulate and to promote that blood flow, that blood circulation. And so I would, just eat a little bit and then expect that it will take, at least 5 treatments at the beginning. But sometimes, I've treated people, especially pain, that it's one treatment, it's all gone.
Yeah, we see that a lot where someone will ask like how many treatments, and we tell them, the normal 5 to 10 things, but then after one visit, their pain's gone.
Yeah.
Is there a chance that that's going to come back if they don't get additional treatments after the pain is gone?
That's why afterwards, sometimes you have, even if you have more like a maintenance type, even if you're not having the pain, you do a little bit more treatments to help heal the root of that problem. And so then that way, then it doesn't come back.
Yeah.
I think a lot of times, especially here in the U.S., in the West, once something's gone, we think, we're good, and they don't come back or do something else. But it does come back sometimes, like especially back like pain and stuff will come back, and so you need to do a little bit more, just so you get the root of the problem, to heal your body, even if you're not having that pain or that sign or symptom and stuff.
Yeah. Okay. Anything else you feel would be important for their viewers to know?
I just think that the important thing is that not only acupuncture, but also as licensed acupuncturists and Chinese medicine practitioners that it is a complete medical system. So it's not just acupuncture. It's the herbals, it's the exercise, it's the food, nutrition, and even, the advice we give to get for you at home. So it's a complete medical system to help heal your body. And so when you understand that, then it's not just the acupuncture modality, and that's it. That as Chinese doctors or Chinese medicine practitioners, licensed acupuncturists, those are the things that we use to help heal your entire body, to look at your body as a complete whole. And then also that it is backed by modern research. And of course, we talk about all the ancient Chinese things like qi, blood, essence, things like that. But as Chinese medicine practitioners, that's how we will think in terms of doing Chinese medicine diagnosing and treatments and stuff. But then biomedically, research has shown that it will affect the body, change the body's physiological state, whether it's releasing endorphins, neurotransmitters, hormones, serotonin, melatonin, dopamine, different hormones throughout the body to heal your body, or whether it's the gates in the back of the spine that will help with pain control. It will change the blood chemistry within the body to heal your body. Your body's capable of self-healing. And so that's what those things, just biomedically, through our modern research, we found that.
Yeah.
And there continues to be, research on not only mechanisms, but on conditions, on how acupuncture works and how it'll help with different conditions. And so I just think that's just modern thinking about it. A lot of people, they don't understand about qi, blood and stuff. So it's more foreign. But just in our modern society, when we talk about the blood, the hormones, the neurotransmitters, things like that, that's what will help people to understand more that acupuncture will change that. And it's not just some placebo effect or some voodoo type medicine that's been passed down through thousands of years.
Yeah.
Acupuncture's been practiced for 3,000 years and it's still around, and for a reason.
Yeah.
That it does have an effect on the body to help heal the body.
Yeah.
So,
well, I think this has been a great time. I think we learned a lot. Hopefully our viewers will appreciate the content. And if you do need to contact us, you can contact us on our website at luhealthcenter.com. If you want to schedule an appointment, you're welcome to give us a call. We also accept text messages. The phone number is 801-463-1101. And we do appreciate you guys joining us today, and we'll see you next time.
Yep. Thank you very much. Thank you for joining us. We hope you enjoyed today's episode. Please like and subscribe to the podcast and YouTube channel. We'll see you next time.